Robert was 72 when he quietly stopped joining his friends for their morning walks. His legs felt unusually heavy by the time he reached the end of the block. His feet stayed cold, even on warm afternoons. Every step seemed to chip away at his confidence. Like many people, he blamed aging. He figured this was simply how life looked after 60. During a routine appointment, a vascular surgeon listened carefully instead of rushing to an answer. Then came one unexpected question. "Show me how you usually walk when you're trying to improve your circulation." Robert hesitated. No doctor had ever asked that before. At first, the question sounded almost too simple, but it hinted at something most people never consider. Maybe the problem wasn't only how often he walked. Maybe it was how his muscles worked with every step. That single conversation changed the way Robert thought about movement. And it raises an important question that deserves a closer look before assuming the solution is simply walking more. Poor circulation is a phrase people use all the time, but it doesn't always mean the same thing. To understand what may be happening, it helps to picture your circulatory system as a two-way highway. Arteries are the roads that carry oxygen-rich blood from your heart to the muscles and tissues in your legs. Veins are the return route, carrying blood back to the heart so the cycle can begin again. As we get older, that system can become less efficient. Blood vessels naturally become less flexible, muscles may weaken from spending more time sitting, and conditions like diabetes, peripheral artery disease, or chronic vein problems can interfere with healthy blood flow. Research suggests that staying physically active can support circulation, but movement is only one part of the picture. It's also important to remember that heavy legs, swelling, numbness, or cold feet don't automatically mean poor circulation. Nerve problems, joint conditions, medication side effects, and other health issues can cause similar symptoms. That's why getting the right diagnosis matters. One of the most remarkable helpers in this entire system isn't your heart alone, it's your calf muscles. Many doctors call them the body's second heart because every strong contraction helps push blood upward against gravity. But why does that simple fact make such a difference? Walking is one of the healthiest habits you can build after 60. It supports your heart, strengthens your muscles, improves balance, and helps you stay independent. That's why so many doctors encourage it. But here's something many people never hear. Walking alone isn't always enough to get the most from your calf muscles, especially if your goal is supporting healthy circulation. Think about a slow stroll with short, careful steps. If you're stopping every few moments, shuffling instead of rolling through each step, or barely pushing off the ground, your calf muscles may not contract as powerfully as they could. Since those muscles help squeeze blood through the veins toward the heart, weaker contractions may provide less assistance to that natural pumping action. This doesn't mean walking is ineffective. Far from it. The key is understanding that how you move can matter just as much as how far you go. A shorter walk with confident steps and active calf muscles may offer greater support than a much longer walk filled with hesitant movement. That realization surprised Robert. He didn't necessarily need more miles. He needed to use the right muscles more effectively. And one simple movement, often overlooked, can help wake up those powerful calf muscles in a way ordinary walking sometimes cannot. For many older adults, one of the simplest exercises can also be one of the most effective for supporting healthy leg circulation. The calf raise, sometimes called a heel raise. It doesn't require expensive equipment or a gym membership. Instead, it focuses on strengthening the muscles that naturally help move blood upward through the veins. Stand behind a sturdy chair or hold onto a countertop for balance. Place your feet about hip-width apart. Slowly lift your heels until you're standing on the balls of your feet. Pause for a second, then lower your heels back to the floor with control. As your calf muscles tighten, they gently squeeze the veins running through them. This action helps push blood back toward your heart, working with the tiny valves inside the veins that help keep blood moving in the right direction. If standing feels uncomfortable or your balance isn't steady, don't worry. You can perform the same movement while sitting. Simply keep your toes on the floor. Lift your heels as high as you comfortably can, pause briefly, and lower them slowly. While the seated version may not provide the same challenge, it can still activate the calf muscles and may be a helpful starting point. Move at a slow, comfortable pace. Breathe normally instead of holding your breath, since steady breathing helps avoid unnecessary strain. Stop if you experience sudden, severe pain, dizziness, or other concerning symptoms, and speak with your healthcare professional before beginning any new exercise routine if you have known vascular disease or other significant medical conditions. Research suggests that consistent calf strengthening exercises can support healthy circulation when combined with regular physical activity and appropriate medical care. They're not a cure for blocked arteries, damaged veins, or other vascular conditions, but they can become a valuable part of an overall plan to stay active. So why do some people practice this exercise faithfully and still notice very little improvement? Even a simple exercise can lose much of its benefit when it's done the wrong way. One of the most common mistakes is rushing through the movement. Quick, bouncing repetitions don't give your calf muscles enough time to fully contract and relax. A slow, controlled motion is usually far more effective. Posture also matters. Standing with your shoulders relaxed, your body upright, and your weight evenly balanced helps the right muscles do their job. Many people unknowingly lean too far forward or grip a chair so tightly that they change how the exercise works. Another mistake is holding your breath. It often happens without thinking, especially during effort. Instead, breathe naturally throughout each repetition to help your body stay relaxed and avoid unnecessary strain. Consistency is just as important as technique. Doing heel raises once in a while is unlikely to produce meaningful changes. Research suggests that regular practice over time is what helps build stronger muscles and better supports healthy circulation. It's equally important to listen to your body. Mild muscle fatigue can be normal, but sharp pain is not. Skipping a brief warm-up or pushing through significant discomfort may increase the risk of injury instead of helping. Finally, don't expect overnight results. Healthy circulation is supported by steady habits, not quick fixes. And as many healthcare professionals explain, these exercises become even more valuable when combined with a few simple choices you make throughout the rest of your day. Exercise is an important piece of the puzzle, but what you do during the rest of the day matters just as much. If you spend long periods sitting, try standing up and moving for a few minutes every hour. Those short movement breaks help your leg muscles stay active instead of remaining idle for hours at a time. Staying hydrated is another simple habit that supports your body's normal functions, including healthy blood flow. Drinking enough water won't cure circulation problems, but it helps your body work as it should. Wearing properly fitted supportive shoes can also make walking and daily activities more comfortable, encouraging you to stay active. If your healthcare professional recommends it, elevating your legs for short periods may help reduce swelling caused by certain vein conditions. Maintaining a healthy weight can also reduce stress on your legs and improve overall cardiovascular health, which includes your heart and blood vessels. Some people may benefit from compression stockings. These specially designed socks apply gentle pressure to the legs, helping blood move more efficiently through the veins. They're not right for everyone, especially people with certain artery conditions, so they should be used only under the guidance of a qualified healthcare professional. Finally, remember that exercise and healthy habits work best when combined with any prescribed medications or treatments your clinician recommends. But how do you know when leg symptoms are more than an inconvenience and deserve prompt medical attention? Robert's story had a hopeful ending, but not because he discovered a magic exercise. His surgeon identified the cause of his symptoms early, recommended the right treatment plan, and showed him how targeted movement could support his recovery. The heel raises became one helpful tool, not the entire solution. That's an important reminder for anyone experiencing ongoing leg problems. While regular exercise can support healthy circulation, some symptoms should never be ignored. Severe leg pain, wounds that won't heal, sudden swelling in one leg, unusual changes in skin color, or feet that become extremely cold or pale deserve prompt medical evaluation. And if leg symptoms are accompanied by chest pain, severe shortness of breath, or sudden weakness, seek emergency medical care immediately. The good news is that many people can continue enjoying active, independent lives by combining healthy movement with appropriate medical care and realistic expectations. Small, consistent habits often make a meaningful difference over time, especially when they're guided by the right diagnosis. If you found this video helpful, consider sharing it with someone who might benefit. Don't forget to like the video, subscribe for more evidence-based health insights, and keep taking small steps today that can support a healthier tomorrow.